Good day or evening, everyone. Welcome to our webinar. My name is Iyad Sibai. I am a Senior Director of Data at the Royal Commission for Riyadh City. And I'll be serving you today as a moderator. You will be hearing a presentation from Dr. Joe Kiani, the founder of PSMF. Dr. Joe is the founder of Massimo, a global medical technology innovator. Dr. Joe has been a beacon for patient safety and innovation in the healthcare for more than 35 years. In 2012, Kiani founded the nonprofit Patient Safety Movement Foundation with a commitment to eliminate preventable patient deaths in the US hospitals and significantly reduce the medical errors worldwide. Now, moving along to our session, please welcome Dr. Joe to deliver the presentation on this very timely subject.
Thank you so much for having me. Thank you for this honor and opportunity to speak with you. I recently visited Saudi Arabia, Riyadh, and was so impressed by the investments being made in your country, especially in the area of patient safety and healthcare. I visited your virtual hospital office, and I have visited so many of these around the world. I've never seen anything like it. The not only the extent of capabilities you have, but the passion of the clinicians that want to make sure everyone from the citizens of the kingdom in the far reaches of the kingdom to those visiting the kingdom for Mecca to have the best care possible. And to be doing this in a time when there's so much bloodshed and injustice in the region, it takes even more courage. It takes even more stamina, more persistence, and heart. So thank you for that. My background has been really with patient safety since I started Massimo about 36 years ago. My goal was to solve the problems of inaccurate, non-invasive monitors that gave so much false alarms and so much lack of good data. They really were foul weather friends. I was fortunate enough with my partner, Mohammed Diab, to invent signal extraction technology and create pulse oximetry that works even in the most difficult situations, including patient movement and low blood flow. That technology revolutionized monitoring. It helped reduce blindness in babies in the neonatal ICU. In the US, 2,000 babies were going blind every year due to retinopathy of prematurity. The accuracy and reliability of our pulse oximetry technology helped eliminate that. Dr. Augusto Sola did the original study at Cedars-Sinai that showed with our technology and a new protocol to not let babies get over-oxygenated, they could reduce retinopathy of prematurity dramatically. I think the Vermont-Oxford network puts the number about 12%, which was about the same as Cedars, to 0, and very low birth weight babies, I think from 30% to around 4%. So this technology has made a huge, huge impact. Dr. Gurnelli showed that the accuracy and reliability of it could help detect newborns that looked healthy with critical congenital heart defect. The screening with our technology now has become the standard worldwide, including in Saudi Arabia. And also taking it into the post-surgical ward, allowing pulse oximetry to be useful where patients were awake, but they were on opioids, and sometimes they never woke up from the opioids. So that heritage of patient safety is really what led me to begin Patient Safety Movement Foundation in 2012, with the knowledge that we were losing 200,000 patients a year in US alone, 3 million worldwide due to medical errors. And the knowledge that, yes, to err is human, but if evidence-based practices were in place, you would not have medical errors. Maybe even get to zero. I'm talking about evidence-based practices like the 5-point checklist by Dr. Peter Pronovost to eliminate CLABSI, to creating technologies that will help reduce hospital-acquired infection, to reduce a failure to rescue. The thing that was keeping a lot of these technologies from coming to the forefront and helping was lack of data. The medical technology industry had walled off their data. And by doing so, technologies like artificial intelligence could not be deployed to keep track of patients' vitals in a way that could help clinicians understand if the patient was getting into trouble. Part of Patient Safety Movement Foundation's goals were to encourage medical technology companies to share their data. I'm proud to say over 90 companies pledged to share their data to help with patient safety. Companies like Masimo, Philips, GE, Zoll, Draeger, Oracle. Significant companies came forward. And therefore, we now have an ecosystem ready to help, ready to deploy AI for better clinical decisions. I have the saying, tyranny of now versus brilliance of historical data. Think about all the decisions that are made around us based on the information now, instead of putting it in context of the historical data. But that happens in our hospitals every day. Decisions are made based on a single blood pressure value, based on a single SpO2 value, instead of the trends. So we can have historical data inform clinical decisions. We can improve patient care. But people are not good at keeping track of historical data. Computers are. They never sleep. They can keep track of everything. And AI can aid in viewing not only historical data, but immediate data to inform clinical decisions. So with availability of data and assistance from AI, errors of omission can be eliminated. And what I call Six Sigma clinicians can be the norm. So Six Sigma is 1 out of 1,000,000. By definition, if you remember your statistical classes, a bell curve distribution puts most people at average at 1 sigma. So as much as we wish every time we're in the hospital, we would have the Six Sigma clinicians be at our bedside, we're more likely to have the normal clinicians be at our bedside. But with assistance from AI, we can have as close to possible the Six Sigma clinicians at the bedside. So I believe the 22nd century healthcare that can be brought forward today can empower patient safety through AI. I know there's been a lot of noise about AI. And yeah, just like any other technology, any other tool, it can be used for bad. But I see a lot of benefits, especially in healthcare, from the use of AI, from helping people diagnose better by reviewing images better, to use of AI to keep track of data for each individual patient to bring about precision monitoring and therefore precision care. And more than ever, we need AI. We have a shortage of clinical staff, nurses, physicians, and a lot of new nurses and doctors are at our hospitals today. COVID, unfortunately, pushed many experienced physicians and clinicians and nurses away. So we have a situation where we have a shortage of 200,000 to 450,000 nurses by 2025, shortage of 124,000 physicians by 2034, and decline in applications to nursing programs by 5%. By 2030, worldwide shortage in healthcare workers could hit 10 million people. And unfortunately, more people are leaving nursing. 14% of nurses intend to leave nursing by 2027. And unfortunately, 89% of even nurses agree the shortage is worse than 5 years ago. So how can we apply AI to improve life? Well, first of all, AI can help clinicians prioritize which patients need care right away. And AI can also help automate diagnosis and treatment. Think about the difficulty of reviewing X-ray, MRI images. Think about how those can be reviewed more effectively by AI. AI is pattern recognition. And with these very powerful microprocessors, very powerful sensors and videos and images, and now not just large language, but spatial AI, you can have AI help diagnose and find problems that sometimes the most trained and gifted human eyes can miss. But there's an area of AI that hasn't been getting a lot of attention, and that is use of AI for predictive and early diagnostics. So imagine when a patient comes to the hospital, when they are admitted, the data, their historical data, transfers into the hospital's workflow. Imagine knowing what the baseline values for each patient is when they're not sick, when they're not in a critical condition, knowing what their baseline pulse rate is, baseline temperature is, SpO2. Imagine knowing their genotype and phenotype. So bring in that historical data immediately in so that you're not thinking every patient has a temperature of 98.6 degrees or 36 degrees Celsius, or pulse rate of 60, or SpO2 of 99. But instead, you know what the baseline of these people are. And if you also know what their proclivity is to drugs, disease, conditions that they're going to be in at the moment of need, when they need your care, the hospital care. This is what's possible. Now that patient enters the room, and now imagine whether it's the vital signs monitors, the infusion pump, the anesthesia machine, ventilator. Imagine all of that information going also into this data where AI will be looking at it. And then the system goes back to the electronic medical record and pulls up whatever data we have for X-rays, MRIs, CAT scans, or blood work. And now, using expert system, using information of what the trends of each of these parameters mean, helping clinicians know what is the state of that patient and what is the probable disease they might be falling into. For example, are they septic? Are they having difficulty breathing due to opioids? And with those information presented to the clinician in an easy to view manner, imagine now what care can be given to the patient. No more errors of omission, no more overload of data, just the right data. So we have had many wonderful new data showing that we can detect sepsis at Massimo, and we could also help show with great sensitivity and specificity the detection of it to the opioid clinical results that we've shown. But I just want to inform you that this AI revolution is a piece of it. Data is king, but action out of kindness is God. I serve on PCAST, President's Council of Advisors in Science and Technology. And last September, we presented our report on patient safety to President Biden. And our report took 2 years to put together. We interviewed every agency that touched healthcare in the US. We talked to other countries, talked to WHO, those that were leading the way on patient safety. And we came up with a list of recommendations of how we can improve patient safety. And this work was done by myself, Eric Horvitz. We were the co-chairs of this working group, but we had incredible members in our working group, from Dr. Don Berwick to Dr. Peter Pronovost, nurse Julie Hammert, to the gentleman who ran the aviation safety. And our report had these following recommendations. Not only should there be a patient safety coordinator inside the White House reporting to the president to coordinate the work that everyone's doing and report monthly to the president the progress, but to make the head of Health and Human Secretary Services responsible for patient safety. So that would be the Minister of Health for most countries. And then our recommendation was to not only make patient safety a priority, but worker safety a priority. Because if we don't look after the workers, nurses, doctors, janitors, everyone in the hospital, it's hard to ask them to look after the safety of the patients. And our recommendation was that immediately HHS, Health and Human Services, identify the top priority harms. There are probably 20 areas where people are being harmed today, whether it's sepsis, VTE, CLABSI, failure to rescue, but have them identify those. Number two, if there's evidence-based practices that are associated with those harms, then make those priority harms priorities for hospitals to implement the evidence-based practices. And by the way, if you go to the Patient Safety Movement Foundation website, we have those high priority harms already listed. We already have the evidence-based practices in place, the executive summary, the details. And I encourage you all to please go to our website and look at those. You can start now. And those are made available to anyone who's our members. Third, we ask that every hospital report their harm. And not just to the government, but publicly on their website. So the members of the public who are going to be coming to those hospitals know how many harms they've had in the past quarter, what type. And we believe that transparency would lead to hospitals working harder and faster to implement the evidence-based practices to avoid those harms. I serve as the chairman of the quality committee of Children's Hospital of Orange County for several years. I recently stepped down from that role. I can tell you, when I first walked into there, not every evidence-based practice was in place. The goal wasn't zero. The goal was to be better than other hospitals. We made the goal zero, and the board and the faculty agreed that a third of the bonus was going to be subject to achieving the zero preventable deaths on an annual basis. Once that was established, something magical occurred. At the next board meeting, the medical team presented a presentation to the board of the evidence-based practices that were on the Patient Safety Movement Foundation website, marked in green for every part that they did, yellow and red for the parts they weren't doing, and a mitigation strategy to get the yellows and reds to green. And unfortunately, despite that, the first year we did not hit zero. But kudos to the team. They didn't give up. They didn't take away the bonus factor. And for the next 6 years, they achieved zero. So I know it is possible to reach zero. You just have to put the evidence-based practices in place. Now, the third recommendation we made to President Biden was that we create a board that consists of not only doctors and nurses and experts in patient safety, but families of patients, patient advocates, to not only continue the quest towards zero medical harm, but to also look for new opportunities, look for new creative ways to eliminate preventable harm. The fourth recommendation was to do investments in technologies that can help improve patient safety, such as AI. And last but not least, also to create this culture of safety and not only a program called Candor, something like it should be followed, which is basically just culture and a learning culture to improve patient safety. Those are what we presented to President Biden last year. I'm proud to report we just had a one-year event on World Patient Safety Day at the White House. And the White House has implemented many of those recommendations. President Biden's goal now is by 2026 to reduce medical harm by 50%. Health and Human Services has identified the top 8 priority harms and is encouraging evidence-based practices to be implemented. So when we speak about action out of kindness is godly, that's what's got to happen. We need to, all of us, know that if in our work, what we do, we're not taking steps to save one life in the next 12 months, we're not taking action to eliminate this terrible, terrible epidemic. The hospitals are supposed to be the safest place. How can they be the place where we lose 3 million people a year to medical harm? Yes, to err is human. Again, there was a study that suggests each one of us makes 5 mistakes a day. But you can put evidence-based practices in place that will mitigate human errors and avoid human errors from becoming medical errors. I hope, I hope you know that to get there, you can't rely on the person on your left or the person on your right. You've got to be the one that goes and makes this happen. I know the job is hard. I, I, I'm grateful to the doctors and nurses for what they do every day. The miracle of healing you provide is incredible. But we can't have people get these incredible procedures and what's available from modern medicine today, and then they die of a hospital-acquired infection or wrong medicine, wrong dosage of medicine. So I want to thank you for allowing me this time with you. I want to remind you that best medicine is innovation. There's a lot of wonderful innovation coming out, especially in the area of the use of AI to diagnose and to keep track of patients before they get in trouble. And with that, I'm happy to take your questions.
Thank you very much, Dr. Jokiani, for addressing the topic today. Dear participants, now we will answer the questions. Kindly post your questions in the Q&A icon so our speaker will answer them gladly. Dr. Joe, while we wait for the participants to have questions, I have a couple of questions for you actually. Um, so what are the biggest challenges healthcare institutions face when they are trying to implement AI-powered solutions? I mean, how can hospitals overcome such challenges also?
Well, I think the biggest challenge is the lack of knowledge about patient safety and quality in the boardrooms of hospital. So I think if the people that are on the board or on the executive level running the hospital would be aware of what is outcomes on every type of procedure that their hospital provides compared to the best hospitals, and what is the number of preventable harms that occur on a daily, weekly, monthly basis. If they have that knowledge, then I believe things can improve. What is measured improves. So it's just got to measure it. The second challenge is this fear that by putting in place evidence-based practices, it's going to increase the costs. Every evidence-based practice we have that I'm aware of, it not only saves lives, it reduces costs. Some of them within months, some of them within a year. And for those of you who tracked quality at Toyota, I know Toyota is hailed as one of the best quality organizations. When Toyota began their quality quest, it was to save money. It wasn't to give customers a much better experience, which of course it did too. But focusing on quality saves money. So the challenges are really ignorance in the boardroom and ignorance about the cost of implementing evidence-based practices, that somehow they will increase costs.
All right, we have one question about the shortage of physicians and nurses. So, with the predicted shortage of physicians and nurses, how quickly do you think AI can bridge the gap, and what role could it play?
Well, I believe a lot of the tools are available today. For example, there are tools with and without AI that can help clinicians remotely monitor patients and then deal with those that are in trouble. So where historically without those tools, rightfully so, the nursing ratio was expected to be 4 patients to 1 nurse. With these new tools, that ratio can become 10, 20. So, and of course, as you bring AI in, that can help take away some of the burdensome research, gathering of data, diagnosis, and you hand it to AI, then it frees up these clinicians to spend more time at the bedside. So I think as our problem with shortages, our problem with an aging population comes forward, fortunately, there are technologies that can free up nurses and doctors to spend more time with the patients and make up for the loss of nurses and doctors.
Dr. Joe, but how can we do that without losing the compassionate care?
Well, nothing replaces love and compassion for patients. I know for years, doctors were taught not to get personally emotional about their patients. That was a bad advice. I know empathy can be painful, but you need the combination of love and technology to help people heal. So obviously, if we have less people, there's less touch and tender care. But with the knowledge that the compassion and love is key to healing, and with tools like the ones we talked about, it can free up clinicians to spend more time at the bedside. Even before the nursing shortage and before the advent of these technologies, there was a study done at UPMC that asked the nurses what percentage of time they thought they spent next to the bedside, and they calculated what percentage they really did. It was shocking. The nurses thought they were at the bedside most of the time. They were at the bedside less than 15% of the time. So we need the nurses, we need the doctors at the bedside, but the aid of technology can reduce some of the workload, like putting information in the computer. I've recently visited the Microsoft headquarters in Massachusetts, where they've taken the nuance recording that they used to have for doctors transcribing and put it in the ceiling so that as they're just doing their job, they can be talking. And with AI, that device can fill in the blanks and help keep the recording of the data for the patient. So imagine how much time that'll save for clinicians and doctors not having to go transcribe.
Great. We have one more question regarding the individuals. How can we co-produce AI services or solutions with individuals for the healthcare providers and the patients, the individuals together? How can we make them work together? Since you mentioned also AI-driven consumer health insights, I believe.
Yes. Well, there's a host of new wearables coming, not the ones made by the toy makers like Apple, but the ones made by serious medical companies like Massimo that allow individuals at home to get reliable monitoring, continuous monitoring, and that the AI that's deployed in hospitals today will be available at homes as well to help people at home look at all of the data that is coming from their body, from their environment, and help them understand what it means so that hopefully they don't burden hospitals and doctors with unnecessary visits, but go to them when they really need it and allow them to be at the comfort of their home most of the time. whether it's being able to treat themselves at home, knowing what they know from these wearables and the AI, with maybe some remote telemonitoring, telecare with their clinicians, or being transferred home sooner after their procedure from the hospital, because you can have hospital at home reliably now due to these new wearable monitors that are reliable at home.
So you said that you believe that we will have some kind of hospitals at home. So what do you think the hospital of the future will look like then? I mean, will everybody have wearables at home and be connected in real time? How do you see the future?
Well, I think maybe the future of healthcare will go back a little bit historically, where a lot of care was done at home before the advent of modern medicine. But also, if you think about how a lot of what we used to do in theaters, we can now do at home with streaming. So a lot of things are going home thanks to the ubiquity of reliable internet and ubiquity of reliable cameras and sensing technologies. So yeah, I think the future hospitals, there's no replacement for them. They will be there. They will actually be mega hospitals, maybe because we know the more procedures done at any individual hospital, the better they do those procedures. But I think there will be less hotel time, less nursing at the hospital time. Look, I remember when my mom and sister got their tonsillectomy when I was a kid, they spent about a week in the hospital. Now they're sent home immediately. A friend of mine had a heart bypass, and was sent home within a day. That used to be a 1 week, 2 week stay at the hospital. So this is happening. But a lot of these people were being sent home without reliable telemonitoring. With the advent of these reliable telemonitoring technologies, now when they're sent home, they can still be under the care of their hospital and their clinicians. And if they're getting in trouble, they can go in and save them. I'll give you a great example of that. During COVID, as you remember, many hospitals were too full. They could not take every patient. Some patients were being parked in the hallways, some in the garages. Well, Massimo came up with technology for COVID. We call it safety net COVID. And hundreds of hospitals sent their patients home who had COVID that did not need immediate ICU care and remotely monitored them. And when they got in trouble, they brought them in for ICU care. University Hospital in Ohio did a study of this work and showed that not only they saved $11,000 a patient, but mortality dropped by 70%. So this world of COVID that unfortunately came, it also had a silver lining. It sped up the whole transfer of telemonitoring and telehealth care. And I think we can take advantage of it and reduce the burden to the already very, very busy hospitals and allow the patients to be home sooner and as long as possible.
All right. I'm looking into the questions, something that we haven't answered yet. Are there any limits of AI technologies in the medicine field? And are we exceeding these limits?
We haven't even begun. So we're just starting. And I feel like there's a revolution of medicine coming our way. We spent a lot of time talking about use of AI for diagnosis, for letting clinicians know sooner rather than later when patients are getting in trouble. But I believe AI will be used to speed up drug development. I believe AI will be used to speed up materials improvement for use in healthcare. So, and who knows, one day with the combination of AI and robotics, we can hopefully also reduce errors and improve the standardization of best practices. Today, due to the way information gets disseminated, there's about a 15 to 20-year gap between what is best medicine and what is common medicine. And I hope AI will help bridge that. So don't get me wrong. I'm not telling you AI can only be good. AI can be used for bad. I worry about negative usages of AI. I worry about fake news. I worry about distortion. I worry about AI being used to subjugate people. So we just have to catch up with it. We have to have proper regulatory barriers for everyone, not just us as citizens, but even for governments on their use of AI. But when it comes to healthcare, I only see upside by use of AI in healthcare.
All right. There is this common question that everybody has in back of his or her head. Will AI replace, of course, not, it's not going to replace patients, but will it replace doctors, nurses? Since especially people are saying, will AI be cheaper than humans? And what would that mean? What do you think? What's your opinion, Dr. Joe?
Well, I don't think AI will replace us from being productive human beings. But I do think many of the jobs, both white collar and blue collar, within 10 to 20 years will be done by AI, AI assisted robotics and AI. But this is not the first time we've had a technological revolution. Think about farming. There's been a huge revolution of farming by the evolution of tools. Think about assembly lines. Think about factories and automation. I believe these tools have, if you look at it in hindsight, have helped us. I think they've improved the human condition. They've taken us out of poverty. You know, the headlines are ugly, but the trend lines are pretty good long term. And so I think the same way going forward, that AI will take away some of the jobs, but will never take away the creativity of a human being. And I think the more creative a society is, the more they'll be able to use AI to advance our society and the human condition in general. So I think back when I started Massimo 35, 36 years ago, had I had the tools I have today with AI, yeah, I probably would have had less employees. I probably would have gone a little faster and maybe eventually employed more employees. So I just think the jobs will change, but I don't think the jobs will go away. And I don't believe the expertise of doctors, the love and attention of human to each other will ever be replaced by AI or any machine.
Dr. John, you talked about the wearables. Do you believe these wearables will make healthcare accessible to low-income countries? Or do you still believe those wearables? Because we see wearables these days, but they are a bit expensive, to be honest. Not being afforded by everybody. Especially, I saw this one device that you can wear, but you have to have a $20 subscription on a monthly basis. Uh, so will AI or wearables help us to provide healthcare in the low and middle income countries? How would that be possible?
Yeah, I think eventually prices will drop and it will become available to everybody. Look, whether it was, I guess, digital LCD TVs that came and replaced CRT TVs or cell phones, initially they cost a lot of money as people try to get the first products out the door. I remember the first digital LCD display TV was like $20,000. Now they're all under 1,000. Cell phones. I remember the first Motorola cell phone I bought cost a couple of thousand, and then later those phones were being given away with the with the cell service. Of course, with the advent of smartphones, they've learned they can charge a lot more for those, and so those things can come and go. But no, at the beginning, I think of any new technology, um, while it's immature, while the scale of production is small, it is expensive. It's afforded only by rich areas, but eventually by everyone. And I also think it makes sense for some of the rich countries to provide these wearables today to people in rural countries, where sometimes diseases like COVID, uh, monkeypox might come out of. Could you imagine if in some of these villages where some of these diseases sometimes spread and turn into a pandemic, if people either had wearables or other ways of just simply checking temperature? And if you see a higher rate of fevers than normal, people could go help those people, not only heal them, but make sure it doesn't spread. So I think there is going to be, until it's affordable to everybody, there might be intelligent philanthropy uh, to help everybody that may make wearables accessible to everybody.
Thank you, Dr. Joe. So one last question. Is there any AI-assisted clinical decision-making systems for clinical diagnosis being used these days? Or yeah, this is the last question we have.
Yes, not talking to you as CEO of Massimo, because you may know I've recently resigned from Massimo, the company I founded 36 years ago. But I can tell you that Massimo has introduced AI-based algorithms called Halo. It was first introduced in 2010. Today, Halo not only helps many hospitals know the status of their patients as it's changing, but also there's Halo for opioid-induced respiratory depression. There is a sepsis Halo that's in limited market release mode that will soon be fully available. So yeah, there are in not just in R&D, but in real world available today tools. I'm aware of only this one, but that's commercially available, but I'm sure others are coming if they're not out there already.
All right. Thank you, Dr. Joe. On behalf of the Saudi Patient Safety Center, we would like to thank you and thank the audience too for their active participation. As part of the Saudi Patient Safety Center's efforts to provide you with timely topics and interesting speakers, we would appreciate if you could fill out the evaluation survey sent to your emails after the session. Thank you for joining us today, and we look forward for welcoming you back in the future webinars.